Okay, hello everyone, and thank you for joining us for this webinar presentation on understanding autism spectrum disorder, or ASD, and the strategies to help support students with ASD. My name's Erin, and I'm one of the school psychologists at Manitoba First Nations Education Resource Center, or MFNERC. Also joined by Annie, who is one of our speech language pathologists, and Lindsay, who is one of our occupational therapists, and Jessica, who is one of our physiotherapists. So we work in the clinical services department. Okay. So these are the main objectives that we're aiming to cover today. And that is to gain an understanding of ASD and the underlying neurological characteristics associated with it, as well as to learn strategies to help support students with ASD within the school setting. Okay. So I'm going to start by first giving an introduction to autism spectrum disorder and the neurological characteristics associated with it. Annie, Lindsay, and Jessica will also be sharing some effective tools and important information and strategies that pertain to their areas of expertise to help support our students with ASD in the school system. Okay. So this is a question that was asked by Susan Stokes, who is an expert in the field of autism spectrum disorder and supporting students with autism. And she asked the question, what is the #1 intervention when working with students with ASD? And that is to gain a full understanding of autism so that we can better support students with autism, as well as understand more of the whys behind other strategies that might work with this particular population. So that's where I'm going to start, is by providing an overview of ASD. So what are autism spectrum disorders? So ASD is a neurological developmental disorder that impacts the way individuals communicate and interpret their environment. So I underline neurological just to really emphasize that autism is a brain-based disorder. So meaning that's how their brains are wired. It's not a disorder that's kind of acquired later in life, strictly impacted by environment in any way. So on the spectrum, so there's a saying that goes, when you've met one person with autism, you've met one person with autism. So each individual with autism is unique with differing characteristics and abilities and strengths. I also want to quickly point out that as you can see, it is autism spectrum disorder now. There's no longer terms such as Asperger's or autistic disorder used in diagnosing in the current edition of the DSM. Although we might still have students within our schools who were diagnosed using these terms. So just something to keep aware of. And lastly, autism spectrum disorders is commonly characterized in varying degrees of difficulty in social interaction, verbal and nonverbal communication, and repetitive behaviors. So this is the criteria of ASD that's outlined in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. So this is the criteria that doctors and psychologists and psychiatrists use when evaluating individuals for ASD. So if we look at criterion A, it states that there are persistent deficits in social communication and social interaction across contexts. So some examples of this would be that reciprocity in social situations, like the give and take involved in a conversation, responding in conversations, understanding why someone else is maybe sad. So those facial expressions, taking things very literally, so they may not always understand sarcasm or jokes. It could also include deficits in nonverbal communication, so such as limited eye contact, limited facial expression, or limited joint attention. Other deficits might include struggles maintaining relationships, not always understanding social contexts, or struggles with imaginative play. And then criterion B states that there are restricted repetitive patterns of behavior, interests, or activities. So this would include behaviors such as always needing to line up their toys a certain way in a certain order, hand flapping, echolalia, so repeating back what others are saying, insistence on sameness, ritualized routines or rigid thinking. So they may need to eat the same foods every day, or they may need to take the same route to school every day. They may also have overreactions to small changes in their schedules. So, and they may also have limited interests or perseverate on certain topics. And then lastly, they may also be hyper or hyporeactive to sensory input as well. So things like lights or sounds, tags on their clothes may really bother them. So these symptoms must be present in the early developmental period, and severity is based on this level of impairment. And then I want to quickly just say that the treatment plan for these individuals, it's very much multidisciplinary, meaning input from occupational therapists and speech pathologists, physiotherapists, parents especially, teachers, EAs. Their input is all very crucial for the treatment plan. And while autism is usually a lifelong condition, all children and adults can benefit from interventions or therapies that can reduce symptoms and increase skills and abilities. Okay. So this is an iceberg that was adapted by Susan Stokes. And I just wanted to put it in here to kind of illustrate that a lot of the times what we're seeing is the behaviors associated with ASD and those behaviors that are above the waterline. And as you can see, it's just the tip of the iceberg, and there's so much more going on beneath the surface that we don't always see or know that's happening. So you could see those neurological characteristics that are likely influencing some of the behaviors we're seeing. Okay. So autism is a very complex diagnosis. A lot of the symptoms and the characteristics and the behaviors associated with ASD, they often resemble symptoms of other diagnoses. So these are just some examples. So if we look at, for example, OCD, obsessive compulsive disorder, a lot of the compulsive or ritualistic behaviors associated with OCD, they often resemble those ritualized routines and perseverative behaviors associated with autism. Individuals with autism, they often experience extreme stress and anxiety, especially when there's changes to their routines. So a lot of the times they'll have those anxious behaviors. Individuals may be diagnosed with or without intellectual disabilities when they're diagnosed with autism. Abnormalities of attention, so either being overly focused or easily distracted, are common in individuals with ASD. So again, those ADHD behaviors. And as we know, deficits in communication are common with this diagnosis, so various communication disorders may co-occur. So again, these are just some examples. Okay. So priming is a strategy I think we use a lot of the time in our day-to-day activities and in schools, that we don't often even know that we're using it or that it is an effective strategy, especially for individuals with ASD. So it's a strategy used to prepare a student for activities or changes that occur within their day. So priming always occurs before the event. So you want to do this, for example, at the start of their day, going through their schedule with them, before starting an assignment, to help with transitions between subjects, and then even at the end of the day to prepare for any changes that might be coming up the next day. So the purpose is to decrease anxiety and stress that accompanies change and new situations, and to familiarize with material before use, and to provide predictability in the information or the activity, to increase overall student success, and it prepares them for the day. Okay. So why does priming work? So overall with priming, it lessens the anxiety levels. So with priming, we're preparing the student for the task or the activity or the transition before it occurs. So because the student knows what to expect, the chances of them experiencing those really high levels of anxiety when the change actually comes is greatly reduced. And students with ASD, they tend to not like trying new things, mainly because of that rigid thinking and perseverating behavior patterns that they might have. So once they master something or a task, their anxiety is decreased. So it's very hard to get them to move on to something else. And we might see that in schools where they want to learn the same thing over and over because they're very comfortable with that certain topic. As well, expectations are clear. So we want to make sure that we're clearly communicating what our expectations are in a manner in which the student can comprehend. Priming also provides predictability. So it gives the student a sense of predictability, which again lessens that anxiety level and helps them to function a lot more effectively. And then one more thing I will quickly mention on this topic is that when we use priming, we want to do more than give a heads up of a change coming. We want to plan for that change as well. So we may even give the reminder more than once or weeks or days leading up to that change, depending on the student and what the change is. So for example, if the school is having a pep rally coming up, you might prime the student for that pep rally. Not only giving them heads up of the change in their schedule, but just what to do if they get, say, overwhelmed in that particular situation. So you might say something like, remember, tomorrow we have a pep rally at 1:15 during our music block. So we won't be at music, we'll be in the gym. Remember that if things get too loud or too much, you can go to your quiet or your calm space, like we talked about. So that would be, it'd also be a good idea to maybe include this new activity in their visual schedule, which I think Annie will be talking about. Okay. These are just some examples of priming techniques in the school. So reviewing the visual schedule to start their day, informing them of any changes in their schedule, introducing new people. So if the student might have a substitute, course or subject content, and preparing for assemblies or social activities. Okay. And before we move on, I want to start looking at some before we start looking at some more strategies, I want to emphasize the importance of really capitalizing on the strengths and the unique abilities of our students and individuals on the spectrum. So we always need to consider ways to utilize those strengths to support their learning and help them stay engaged, and just to really increase their level of independence. So this is just one example. So a student who always needs to line up their markers. This student might have very great organizational skills, or they're very neat. A student who fixates on plants might grow up to be a famous botanist. A student who is nonverbal may be highly observant, observant of and attuned to their environment, so they may be a very strong visual learner. And a student who needs music to calm was able to independently identify their own calming technique, and maybe they'll grow up to be a musician. Okay. And lastly, this is a great visual from Harriet Cannon at the University of Leeds, and it just shows a lot of the positives and a lot of the strengths that individuals with autism usually or often have. So things like attention to detail, they're very observant, they have very excellent memories, and their visual skills are often very advanced. Again, we always want to capitalize on their strengths and the positives as much as possible, while at the same time still keeping in mind that each child is unique based on their abilities and their skills and their characteristics. So now I am going to pass it over to Annie.
Hi everyone, my name is Annie Nehusen and I'm a speech language pathologist with Manitoba First Nations Education Resource Center. I'll be discussing speech and language strategies to support students with ASD in the classroom. Okay. So I wanted to begin by discussing the speech language pathologist role when working with students with autism spectrum disorder. So as most of you probably know, the speech language pathologist helps with communication. As Erin mentioned earlier, students with autism spectrum disorder have differing characteristics with their own unique strengths and abilities. So this is also true for communication. But I'm going to specifically emphasize social communication deficits in my presentation, since this is a defining feature of ASD. So what is social communication? Social communication is the use of language in social context. It includes following rules for conversation, like knowing how to take turns with your conversation partner, or knowing how close to stand to the person you're talking to. Social communication also includes joint attention, and joint attention is an early communication skill. This is when two individuals focus on the same object, and this will be discussed later in the presentation. Social communication also includes the ability to vary communication based on the context. So this is knowing that we speak differently to our teacher at school when compared to our friend on the playground. And social communication also includes perspective taking and understanding what is not explicitly stated. So the first strategy I'm going to discuss is social stories. And social stories are short stories written in first person. They help students understand behaviors, routines, skills, or concepts. So on this side, I've included some examples of social stories. So on the left, we have some social stories in book formats. And on the right, we have a one-page social story. And the format you make the social story will really depend on the child. You can make books, PowerPoints, comic strips. It really just depends on the child and what they prefer. So when writing social stories, first we want to determine the issue we want to address. So this is the behavior, routine, skill, or concept that we want to work on. Or it could be the event that's the anticipated event that's coming up. And usually we address this concept in the title of the story. So if we're working on safety in the car, we could make this our title. And this will help the student understand from the beginning what the story is going to be about. When writing the social story, we want to remember to keep the story short. It should be short enough that the student stays engaged throughout the story, and it should only focus on one specific situation or skill. The language we use in the story should be literal and easily understood by the child. The language should also be positive. We should avoid using words like shouldn't, couldn't, or bad, as they might sound like disapproval, or it might be discouraging to the student. So instead of writing these sentences, we should provide positive strategies. So for example, we could say, I will take 5 deep breaths instead of I won't hit. And finally, we're going to personalize the story. We want it to match the student's age, personality, and learning style. So we're going to use pictures of girls if the story is for a girl, pictures of boys if the story is for a boy, and we also want to reference things or people in the student's life. So maybe a teacher or a friend. And personalizing the story makes it more enjoyable for the student and more likely they will engage. So Carol Gray describes the 4 types of sentences we use in social stories, and knowing these can help you when writing your own social stories. So first we have descriptive sentences, and these sentences describe what is happening. These are truthful statements. So for instance, my name is George, I am in grade 3. Next we have perspective sentences. And these sentences take the perspective of another person. For example, during story time, others are trying to listen to the story. Coaching sentences gently guide or coach. I will try to be quiet during story time. And then finally, we have affirmative sentences, which are positive and reassuring sentences, like, this is a good thing to do. So when writing social stories, less than 1/3 of the sentences should be coaching sentences. And if you wanted to learn more about Carol Gray's strategies for writing social stories, you can go to her website. So once you've created a personalized social story, you want to introduce it to this child, and it should be read regularly as part of the student's routine. You also want to make sure you're considering the environment when you read the story. So avoid reading it when the student is anxious or upset. You want to read it when the student is calm, and you want to read it in a positive, reassuring manner. So now we're going to discuss visual supports. And visual supports are any visual that helps the student see what you mean. They may help the student develop routines, sequence tasks, or transition from one activity to another. So on this slide, we have a first-then board. And a first-then board can be used to help with transitions or to motivate the student to complete a less preferred task. So as you can see, the first-then board shows that something preferred will happen after we do something that's not as preferred. Maybe the student doesn't like reading books. So first we read the book, then we play. On this slide, we have an example of a visual schedule. And visual schedules can outline the entire day, or they can outline just steps within a task. And this example just outlines the steps within a task. So how to wash your hands. And visual schedules help with transitions or to break down tasks with multiple steps. So here is an image I found on northstarpass.com, and it's on the 9 reasons to use visuals. So visuals are permanent. Spoken words disappear. Visuals allow time for language processing. Visuals prepare students for transitions. Visuals help kids see what you mean. Visuals help all students. Visuals help build independence. Visuals are transferable between environments and people. Visuals have no attitude, no tone, no frustration, and no disapproval. And visuals help reduce anxiety. So now I wanted to move on from those strategies just to briefly discuss augmentative and alternative communication, or AAC. And AAC is used by individuals to communicate without spoken language. And often we see students with autism spectrum disorder utilizing AAC. So AAC can be low tech or high tech. So low tech devices include paper and pen, picture boards. We also have switches, and high tech devices are more of like Proloquo to Go, which is an app on the iPad. So on this slide, we have example of AAC devices. So the first image in the left corner is of the app Proloquo to Go, and the student will press on the icons and the device will generate speech. And the icons and the voice output can be customized for the student. And there's also folders that when you press on them, it opens up more icons. So there's a lot of options with the app. And then in the right corner, we have just a basic paper board that has less options, but it has all of the most common words that the kid's going to use throughout the day. And then at the bottom, we have a switch. And usually for the switch, the speech language pathologist will record her voice so that each time you press one of the buttons, that you'll get voice output. So here are some tips for using AAC in the classroom. It's important to model how to use the AAC device. Children learn to use language by imitating those around them. Through models, you're teaching the student how to navigate the system and sequence steps. It's also important to ensure the device is always available and easily accessible. The student is more likely to use the device if they have easy access to it. You also want to make sure to focus on core words. And core words are the words we use most often and in almost every situation. Some examples of core words include I, me, you, we, my, want, need, yes, no, he, she. So these words aren't specific, they're more general words that we use every single day throughout various situations. And finally, you want to allow the student to explore the device. So if the student is using an iPad, let them independently explore the iPad. And this allows the student to learn how the device works and discover new words. And just remember to be excited and acknowledge any attempt the child makes to communicate, because this shows that their words are meaningful. And that's it. So I'm going to pass it off to Lindsay.
Okay. Hello, everybody. My name is Lindsay Fingland. I'm an occupational therapist with MSNERC. I wanted to start just by saying that a lot of what I'm going to talk about today is strategies and ideas that are used with students that have autism, but it also can apply to a really large population. Really anybody can use these strategies or could benefit from some of these strategies, just like Erin said. So yes, they are useful and we can use them with our students that have ASD, but there's a lot of students and really anybody would benefit from using some of these things. So just quickly, as an occupational therapist, I work with students on their self-regulation, their sensory processing, play skills, social skills, attention, fine motor skills, sometimes gross motor skills. So the role is really varied, but I'm going to focus on just a couple things today. So self-regulation. This is the ability to do what needs to be done in the optimal state for a given situation. So this is regulating your sensory needs, your emotions, and your impulses to meet the demands of the environment, reach your goals, and behave in a socially appropriate way. So essentially, what do I need to do in the classroom? How is that different from what I need to do in the gym or at recess or when I'm with my friends at home? How is that different? And how do I need to make my body react and change differently to different environments? So everyone has what we call a window of tolerance. That's what's in the middle there. This is your window of tolerance. And the important thing to note here is that as soon as you go out of your window of tolerance, so either you're hyper aroused or hypo aroused, we lose our ability to use cognition or our higher level thinking skills. So we lose our ability to organize, make judgments, plan, communicate effectively, control our emotions, all of those things, we lose them. So that's why it's really important that we find strategies to help us stay within our window of tolerance. And this goes for everybody. Everybody has a window of tolerance, and the width of it, I guess, the size of it is different for everybody. So some people are dysregulated, which is what happens when you go out of your window of tolerance. Some people are dysregulated quickly. Some people, they can tolerate more ups and downs without being dysregulated. So for some, these red lines, this is where their window of tolerance is. It might be much thinner, and it's easier for them to become dysregulated. So for students with autism, it's much easier for them to go out of their window of tolerance. So some things that we think, oh, they just, maybe a student tripped, and they became very, very, very upset by that and appeared really dysregulated. And so for us, where our window of tolerance is these black lines, that may not have sent us out of our window of tolerance. But for a student that has a narrower window of tolerance, that really pushed them out of their window of tolerance really quickly. So we just need to understand that some students just have a much narrower window of tolerance, and when we leave that window of tolerance, we lose our ability to really connect with our higher level thinking skills that really help us to behave appropriately, control our emotions, and communicate with each other. Okay, so one of the main ways that we manage our self-regulation is through sensory input. So everybody has a very unique, we call them sensory profiles. So everybody has different sensory preferences. Everyone has different sensory sensitivities, things that they like, don't like. And if you are at all concerned about a student's sensory needs, sensory preferences, things that they're sensitive to, please come talk to the occupational therapist that works at the school or in the community, and they will be able to help you out, because it is very, very unique to each person. So while I'm going to give some general ideas, the best way to do this and to make it the most individualized is to talk to your OT. So what are our senses? We know the 5 main ones, so touch, sight, hearing, smell, and taste. There's also our sense of balance and movement, and our sense of pressure in our joints and muscles. So the reason that this is so important is that this is what I called it our tree of learning. So the way that our body develops, our central nervous system, so our brain and spinal cord is down here, these really make up the roots of the tree. So our brain, spinal cord have to be developed before our sensory systems can be developed, and then everything else comes later. So you'll notice academic, cognition, behavior, social skills, those are all up here at the top. Even attention and language, visual, perceptual, all of those things are up here. So before we can expect kids to really succeed with their social skills, their language, their academics, their behavior, we have to make sure that these things down here, so our sensory processing systems, our body awareness, our reflexes, those are all developed to where they need to be before we can expect kids to have really strong academic skills. So I'm going to take a second. I want everyone watching this to just look at this photo and think, what are the different sensory inputs that you're seeing in this photo? So just take a moment. think about, we talked about really briefly, we said sights, sounds, hearing, noises, taste, smell, movement, and pressure. So when I look at this photo, I notice there's a lot to see. There's a lot of different colors. It's very busy. There's lots of decorations on the wall. There's stickers here. There's a little bit of clutter in the corner. There's a lot of going on visually. We also have students. I mean, there's no students in this photo, but I think we can assume that students would be sitting in desk groups of about 7 or 8, depending. And so that can make a lot of noise. I'm also assuming that it's a classroom for younger kids just based on the art. So there might be a little bit more noise, a little bit more free play going on. If these windows, it looks pretty cold outside, there might be a draft. So for some kids, the temperature in the room can really impact them. And then who knows what it smells like. We can't see that from a picture. We can't tell how much movement is going on in the classroom, but there's a lot of things that can really impact how our sensory needs are affected in the classroom. So it's really important just to think about all those little things that for us might not bother us, like all these decorations, or if there's a draft coming down, if there's vents in the ceiling, if there's drafts and these are moving or fluttering or making noises. To most people that might not bother them, but for some students, and specifically students with ASD, that might really impact them and they might not be able to filter that out. Okay, so one of the most impactful strategies for managing self-regulation and also just sensory processing in general is incorporating movement. So when we add movement into our day, we actually increase our ability to connect with our higher level thinking skills. So judgment, organization, planning, self-control, social skills, communication, all of those things are impacted by how much movement we get during the day actually. So that's why it's really important, and Jessica will talk about this later, but it's really important for us to incorporate movement into our days as much as we can. So in the classroom, we can have wobble stools, rocking chairs, move and sit cushions, exercise balls, beanbag chairs. We can have students working on the carpet, lying on their stomach. We can use standing desks or let students stand during lessons. We can incorporate movement breaks and heavy work, and we can use fidget tools or bouncy bands on the chairs or desks. So I'll show you a photo here. This classroom has lots of different movement options. So there's pillows here, so kids can sit or lie on the ground. There's beanbags to sit on, a bucket chair, there's wobble stools. There's this carpet here if students wanted to sit or kneel on their knees or stand. There's these little crates with pillows, or I think those are actually exercise balls in there, that students can sit on to give them a little bit of movement. There is movement. There's exercise balls over here. There's another bucket chair. So there's lots of options for us to incorporate movement in our classroom. And then outside of the classroom, this is a photo of one of the schools that I work in where we actually installed a sensory path in the school. So these are just decals that go on the floor, and you can make up your own pattern for how you want the students to move them. So in this one, we did a bear crawl through the numbers, and then this one, it says jump, squat, jump, squat, jump, squat. So students go through the path with some instructions, and they can do this every time they go through the hallway. So on the way to gym, on the way to computer, in and out of recess, every time. So it's just a way to get movement into their day. And then we have heavy work. So heavy work is any type of activity that pushes or pulls against the body. It can help us feel centered in our bodies, and it has an impact on self-regulation. So for students that are outside of their window of tolerance, or you can kind of tell are leaning that way, they're leaning towards being dysregulated, or even students that are perfectly regulated, but you want to kind of put some money in that bank and help keep them there. Heavy work is a really great strategy for helping students with their regulation and just making them feel calmer and more centered. So some examples, we can have students carry heavy supplies to another room. So often I'll ask students to take a package of printing paper or the recycling bin, or even a lunch tray. Some of my schools that I work in deliver the students' lunches in big Tupperware bins, so I'll get students to help carry that. We can do animal walks, so doing a bear crawl or crawling like a puppy, doing crab walks, things like that. You can get students to be helpers. So like I said, carrying the lunch bin, pushing the lunch cart, cleaning the whiteboard. You can put resistance bands around chair legs so that they can kick into it, have students stack and unstack chairs, and then play Simon Says or Follow the Leader. And I like to use that as a transition strategy between classrooms. And so if you are Simon or if you are the leader, you can have students do some of these things like an animal walk, have them push their hands into a wall, do a wall push-up, anything that really works their muscles. Okay, so quickly, I'm going to go through some other tactile strategies, but again, these are just things that are pretty general and not specific to a particular child. So make sure if you are struggling with any of these things with students that you might be supporting, please talk to your OT. So some tactile strategies or touch strategies, you can use fidget tools, put Velcro or felt under the desk so the students can fidget with it, cut off tags on clothes, do messy play, so playing with slime or oobleck, which is cornstarch and water, or make rainbow rice, so just take some rice, put some food coloring in it, let it dry. You can play with Play-Doh or modeling clay, anything where their hands are getting a little bit messy. If the child is okay and can tolerate that. If they can't, but they still want to participate, you can have them put on gloves, just like dishwashing gloves, I don't know how, medical gloves, like the latex or non-latex ones. Of course, make sure they're not allergic to latex if you're using latex gloves, but it's just a way to have them be involved without having that really sensitive reaction to touch. Okay, so for students with auditory or hearing either sensitivities or students that really enjoy, you can use ear defenders or noise canceling headphones. I will make a note, this seems to be kind of a go-to strategy, which is great, except that we don't want to use ear defenders all the time because students then can become oversensitive to noise. So I would say use them with caution, use them during a loud transition or during moments in the classroom where you know it's going to be really loud, like if there's a fire drill coming up or you're playing a loud song or something. Other students though love listening to music. You can provide opportunities for quiet time and for breaks. And then for visual, dim the lights, use a lamp or a desk light instead of the overhead lights. Limit classroom decorations and keep your space free of clutter as much as you can. And then incorporate color and visual cues. So you can use brightly colored worksheets, you can use visuals in the classroom like Annie talked about, using a first then or a visual schedule is a great way to have students who have strengths with visuals really help them succeed. Okay, and then so olfactory is our scent and gustatory is our taste. So for students that just seem to want to put everything in their mouth, we can use jewelry. So that's jewelry that for students that has been specifically designed to be chewed on. And then you can also use crunchy or chewy snacks. So use carrot sticks or celery, pretzels, apple slices, gum if it's safe and there's not choking hazards. You can use essential oils. So when I was talking before about messy play or making oobleck or rainbow rice, even Play-Doh, you can add vanilla or essential oils in really small amounts, and that makes it nice and smelly. And then scented markers or crayons. Okay, so that's all of our sensory stuff. We're going to move on to some social skills. So students with autism may have difficulty with understanding abstract or hidden social rules. Programs like We Thinkers, Social Skills, and the 7 Sacred Teachings or the Circles program help to make these hidden rules more concrete. So specifically with social skills, a huge part of our social skill development is in play when we're young. The main job of a child is to play. So students with autism might have difficulty engaging with other students or adults. They might have difficulty playing pretend, or they might have difficulty playing cooperatively. So like Annie was saying before, and I think Erin brought it up too, joint attention is hugely important. It's one of those, one of the first skills to develop in our social skills and communication skills. So it's paying attention to an object or situation with someone where both people understand that they're both paying attention to the thing. So it requires at least two people to be paying attention to the same thing. So if a child is playing catch with either another child or an adult, both people are paying attention to the ball while also engaging with each other. So examples of tasks that require joint attention include playing catch, building a tower of blocks, having a conversation, or reading a book together. So how do we establish joint attention? The main thing, the number one tip I have for you is play with the child, play with the student, and get on their level. So if they're playing on the floor, get on the floor with them. If they're playing on the couch, sit on the couch with them and follow their interests. So sometimes adults have things that they're really interested in. So some adults might secretly like to play with Lego. They really like playing with Play-Doh. But if the child isn't interested in that, we can't work on our play skills or joint attention skills if they're not interested. So copy the child and follow their lead. When you're playing with them, copy what they're doing, follow their lead, do what they're doing, and wait until they kind of notice that you're with them. Play with them, play beside them, do what they're doing, and then once they notice you, try to change the activity a little bit and see if the child follows your lead this time. If they don't, that's okay. Just go back, keep copying them, keep being there. Even 5-10 minutes a day of playing with them will have an impact. If the child follows your lead though, once you've changed the activity a little bit, just continue to engage with that child for short time spans until the child can engage in your play ideas. So if you are building and the child that you're playing with always build the tower with blocks, and you suggest, let's build a castle, and that child is able to follow your lead and build the castle, then next time you can say, let's build a barn, let's build a farm, let's build a car. See how many different ideas you can interact with that child with the same toy. So eventually you're going to gradually extend the amount of time that you play, the kinds of things you play with, and the areas you play in. So if you always play with Lego, see if instead of building with Lego that day, you can build with a different type of blocks. Or you can build with Play-Doh, but you can still build a tower with Play-Doh. Or if you always play in the kitchen, play in the bedroom today. Or if you always play on the floor, maybe you can play on the kitchen table today. Okay, so what kind of activities can we do to establish joint attention? Blowing bubbles, practice catching them or popping them, play catch or roll a ball back and forth, build a tower, play with little people or dolls or with pretend food, play with toy cars, read a book, play on a water table or sand table and practice pouring things back and forth, paint or finger paint together, and play my turn, your turn. So this can work with any of the activities that I said. If you're playing my turn, your turn, we're asking the child to wait and to look to you. So you say my turn and you put a block on the tower. Then you say your turn and the child puts a block on the tower. And you're going back and forth interacting with that child so that it has to be a two-person activity because it's my turn and then it's your turn. Okay, now moving on a little bit, we know that students who have autism may have fine motor skill deficits. And this is not necessarily inherently because they have autism. It's because they might have missed out on participating in activities that build these skills. So for students who are in school who have autism, they might not have had the opportunity at home, or they might not have had the joint attention at home or in school to be able to do things like playing with Lego or building blocks or playing with Play-Doh in the way that a child who doesn't have autism would. So in order to work on our fine motor skills, we're going to do things like building with Lego or other small blocks, playing with Play-Doh, make snakes or small balls or snow people, pinch pieces between your thumb and your index finger. You can even use scissors and cut the pieces up. And then put a piece of paper up on the wall and practice coloring, drawing, or painting. So this doesn't necessarily have to be on the wall. You could use an easel, chalkboard, whiteboard, anything where that child is drawing on a vertical surface. And the reason for this is it really strengthens their shoulder and their arm and their wrist muscles, and that will help stabilize and strengthen their hand skills as well. Okay, and we're going to move on to Jessica.
Hi everyone, my name is Jessica Sliman. I am a school-based physiotherapist and I work also at Manitoba First Nation Education Resource Center. I'm going to be talking a bit about strategies to support children with autism develop their motor skills. Okay. So although it's not part of criteria for diagnosis, children with autism spectrum disorder can and often do actually have impairments in their movement skills. So Lindsay mentioned a lot about the reason why it's so important for children with autism to have like movement and heavy work in their day to help with self-regulation. And I'm going to talk a little bit more about the more technical reasons why children might fall behind with their movement skills and why it's important that they should continue to work on them as well, children to do that, children with autism to do that. So gross motor skills, so Lindsay mentioned fine motor skills as being something that we should keep in mind with children with autism, and she mentioned some great strategies to support their fine motor skill development. I'm going to be specifically talking about gross motor skill development. And so gross motor skills are movements that use the large muscles in the body to do like bigger movements. So a good example of this is would be like standing on one foot to balance. So important to be able to walk up and down stairs. Another example is catching a ball. That's another example of a gross motor skill. So like I mentioned, these impairments are not necessary for a diagnosis, meaning not all children with autism will show challenges with these skills, but it is possible and it's also very common. And we'll talk a little bit why that might be. So often it looks like when a children's struggling with their gross motor skills, they might show challenges with motor learning, so like a little bit behind compared to their peers at learning new movements. They might also have decreased muscle tone or even have a higher body mass index, and might show a little bit of challenges with imitating movements, so say in a game of like copying. Okay. So this can lead to what we call a gross motor delay. So children compared to their peers being delayed in these skills like throwing, catching, playing, running, jumping, balance, that kind of thing. So what we would term that a gross motor delay. They might show less participation in sports, in gym class or recess, for example, show less interest or ability to engage in activities for a long period of time. So for example, like walking a long distance. So parents might notice that their child is struggling with some of these movement skills or show less interest in say, participation as well. But it's often the case, so they might notice when they're really young that actually children will show a delay in even like learning to walk or learning skills like rolling over, that kind of thing. But it's actually often even more common once kids are in school to, when they're presented with the opportunity to play sports and play at recess, that teachers and parents will start to know notice that they might be a little bit more behind. And so if they are behind, it doesn't necessarily mean that we should be sounding the alarm bells. But there is a cycle. It's good to be aware that there is a cycle that can happen where less active youth often lead to less active adults. And that puts them at risk for health conditions later in life. And research does show that children with autism are at risk for health conditions caused by not being as active in adulthood. So this is just why it's so important. One of the reasons why it's so important for us to support children with autism to continue to develop their gross motor skills. Okay. So I think Lindsay mentioned this as well, that one of the other reasons why children might show that there's a little bit of a delay in developing these skills might be because they were sort of delayed from early infancy, but it also might be that they just haven't had the opportunity to practice some of these skills. So for example, you know, they might be uncomfortable entering gym class based on their sensory profile. They might find the gym really too bright, very loud, you know, it's quite chaotic. And so as a result, they're just not interested in going into the gym. And then, you know, fall even further behind with some of their gross motor skills. At the same time, they also might just enjoy doing other activities, like, for example, playing video games. They might have a kind of a more narrow preference of what their, you know, their preferred activity is, and that doesn't necessarily involve playing sports or that kind of thing. So often we do see that children with autism really do love to move in the way that they want to, but they have a little bit more of a challenging time maybe playing a joint attention game. So again, there's just that less opportunity for them to learn some of their gross motor skills as compared to their peers who don't have autism. Oh, do you think you could go back one slide? Oh, okay. And so then also Lindsay mentioned a lot about why and how play is so important for social and communication development. And so I really find it's kind of like a cycle where, you know, strong social and communication skills develop good play and physical activity skills, and then it's just kind of like a strong cycle. So if children are struggling with you know, verbal communication or social skills, then often they're less interested or wanting to engage in, say, a game that really relies on those social skills. So for example, sports or like a game of playing catch. So it just further decreases the opportunity for them to develop some of those skills. Okay. Okay, so we know that children with autism, so physical activity is important for students with autism for the reasons like that I mentioned, but also evidence shows that children should get 60 minutes of either moderate to vigorous activity every day to minimize health risks. And so it's important for students with autism to get physical activity because it's important for all students to get 60 minutes of physical activity a day. So for actually research too that students with autism, if they have increased physical activity during their day, can lead to decreases in aggression, hyperactivity, their repetitive behavior that they might engage in, reduction or a better management of body mass index, and then increased attention span, focus, motor coordination, activity participation. So there's that participation piece in gym class or sports, for example, and then also in control of inappropriate behavior. Okay. So now we know that children with autism might need some support developing their gross motor skills, and so why that might be. So I'll just mention a few strategies for children with autism to help support them developing these skills. So one consideration is often that children, and this has been mentioned a few times by everyone, that routine is a really important component to a child's day, especially children with autism. So in order to promote physical activity during their day and promote those opportunities where they will have the chance to engage in physical activity, so like recess or gym class or even like movement breaks in their classroom, it's really important to have like a routine and just reinforce that routine during the day, like gym classes coming up, whether it's like verbally, so mentioning that gym class is coming up. You know, Erin talked a lot about priming, which is a really great way of reinforcing that routine with the child. So mentioning that recess is coming up shortly, so they can kind of mentally prepare for that. Maybe having a visual schedule is another great way, or even just having a routine to enter the gym or enter recess and kind of sticking to that. So I know with child that I met was with the same friend every time. And so luckily that friend was really helpful and interested in coming into gym class with them. And he was, the success of him entering gym class and feeling more comfortable was increased. So there's just like some problem solving and creativity around ways that we can support kids feeling comfortable in gym class. And then so again, in terms of getting creative, like with their preferences, there's a ton of opportunity there too to get creative to introduce new activities into a child's day. So say if the child is really interested mainly in playing video games, well maybe they can try a new like cosmic yoga video, or like a Go Noodle that's actually still some screen time, but they're getting up and they're doing the movement video along with the person on the screen. So kind of trying to use their preferences that they have already established to introduce new physical activities into their day is another great strategy. And then in terms of if the child is showing signs of a gross motor delay, so being a little bit behind in their compared to their peers of the same age in some of those gross motor skills, we can adapt the activity that they're doing. We can change the rules. We can change the equipment to make it more appropriate for the level of the child. So, for example, catch is a really great way for kids to work on some motor skills, hand-eye coordination, like some physical activity task, but also get some benefits of playing a game where they are working on turn taking, like Lindsay mentioned, or joint attention. And so catch is a wonderful way for wonderful activity for kids with autism. But some children might have a really hard time starting with just playing catch with a small ball. So one tip is change the size of the ball, like make it a balloon. So a balloon that's gonna like float softer and land a little bit slower, where they can keep their eye and track the balloon a little bit easier. You can move on to then a beach ball, which is also gonna move a little bit slower. And then introduce a dodgeball once they're kind of comfortable catching a beach ball or a balloon. So instead of just starting with an activity that's quite challenging for the child, just adapting the child to the activity to their level. And if you're unsure about what level the child is at and what's appropriate for them to do, it's best to speak to the physiotherapist who, as we're trained in adapting and changing the modifying activities, and can give you a little bit more suggestions on the specific activity. So children with autism also can have challenges with attenuating or paying attention to activities for a long period of time, which again is, it's okay to start with just changing up the activity for every few minutes. So maybe they start with only being able to pay attention to playing catch, for example, for a minute, and then they want to move on to another activity. Well, that's okay, but maybe over time you can sort of gradually start to increase the amount of time they're spent on one activity. But having a few different things that they can do during their day is also helpful. So it's okay to change the activity every few minutes too, depending on where they're at. Okay. Okay, so in the example that a child is avoiding gym class entirely, which again, like I mentioned, this might be, this could be quite common when a child is, uncomfortable with the lights and the loud sound in the gym, depending on their, their sensory aversions. So in this case, it's like I mentioned, it's so important for kids to get enough physical activity, and why continuing to develop their gross motor skills is important. But we don't want to force a child to do anything that they're not comfortable with. And so we want to work with what they can tolerate and what they can do. And so, if you can ask people around that are involved with the child, so say parents, kind of what they're comfortable with, and maybe it's possible to adjust the noise level in the gym. So maybe the child can attend gym just like one-on-one with you for a short period of time. Maybe and then the lights can be dimmed during that time too. Maybe they can even participate for like a shorter amount of time. Another alternative is just to have them do something similar to what the kids are doing in gym, but just in the hallway, or maybe in the corner of the gym. So maybe playing catch with a friend or playing catch with you. Again, it still gets them exposed to some of those physical activities, but in a capacity that's a little bit more tolerant for them. And again, there's that, there would be that use of social stories, visual schedules, priming, to just get that child to be kind of open and ready to enter the gym at their, when they're ready. And then just also gradually introducing a child to gym class. So maybe they never in a week, they never wanted to go, but then the next week they wanted to go one time. Well, that's still a success. We have to meet the child where they're at too. So just starting to really gradually introduce it is okay, because routines take time to change. And then trial and error too is also really important. So like I mentioned, getting creative and continuing to keep trying new things. Again, we don't want to force anyone to do something, but as much as we can increase the child's exposure to different physical activities and explore things that they are interested in doing, we can increase the amount of physical activity they're doing and increase their gross motor skill development. So it's kind of about a little bit of trial and error, and always use positive encouragement. As everybody mentioned. So I'm not going to talk too much about this because I think Annie talked so much about communication and gave some really great ways to enhance communication with children with autism. And Lindsay also talked a lot about sensory challenges. So I think I'm not going to spend too much time on this. But one little tip is in terms of the equipment you might use with a child, in say the gym, it might be nice to just color code the equipment that you know they're comfortable using. So say if you're at the level where they're only using like a balloon to play catch or a beach ball, you might want to color code or just put a little bit of tape on those items and then set it in an area that they themselves, along with you, can go find every time that they're ready to go do that activity with you. And then you always know that it's in the same spot, and it's kind of a routine for you guys to get into to go find that, those pieces of equipment. You're not searching around. And then it might also be a nice thing to do for a child who relies on a visual schedule to take some pictures of the equipment that you use with them. So say some balls, maybe a scooter, those kind of things that you do, that you know that the child likes, and then give them the option to choose that as an activity during their day. Okay. So I'll just talk really briefly about some other movement break ideas for the classroom. Lindsay mentioned it's so important for kids to get movement breaks as part of a like a self-regulation activity. And then I kind of mentioned too, it's just so important for kids with autism to continue getting exposed to physical activity and to developing their gross motor skills. Mentioned it a few times. So some other in the classroom are like Go Noodle or Cosmic Yoga. Those are videos you can find on YouTube for free. Yoga poses are also a really nice way to do a movement break that can be kind of calming because it involves some deep breathing and can also work on balance. So you can also look these up on YouTube. There's lots of free YouTube like videos for children that can be done in a chair or even like lying on the ground. And Simon says it's also to practice copying each other, so it's a joint activity game that relies on copying movements. Then anything really, anything else that you can think of, such as like jumping jacks, hopping on one foot, high knees. Take a minute and have the children in the class try to do jumping jacks for say 30 seconds and then hopping on one foot or something like that. You can kind of pretty much make up anything as a movement break. So lastly, just a plug for physio. So I talked quite a lot about some different strategies that you can kind of take away to use in your schools. But we as school-based physios are trained to work with kids with autism. So we can provide lots of classroom-based recommendations, create programs that are specifically designed for children that would include, unique programs for them. So if you have any questions, just feel free to ask one of the physiotherapists that works in your school, and I'm sure they would be happy to answer any questions you have. And I think that's it. There are some resources that we've gathered together. I just want to thank you so much for tuning in to our webinar, and I hope you enjoyed learning some strategies on supporting kids with autism. Thanks a lot. Anybody have anything else to add?